I'm Jonas Kruse. I'm a first-year integrated resident at UCLA. I know a lot of people here in the chat because a lot of them have been mentors to me, and still in regular contact and communication. I think this is just WCVIS is an awesome community. I think there's a lot of shared mentality I think is important, and being able to bounce ideas off each other and build off that's always awesome. I want to thank WCVIS, the organizers, John, Abinaya, and everybody that's been just a huge part of this for allowing us to speak on these things. It's weird being here because I spoke about being a fourth-year medical student just last year, and we're almost, 2/3 the way through intern year. So tips for surgical intern year. This was something that I think when I was deciding about going into this field, I started hearing that more and more of the residents that are in this field are doing surgery intern years, and that seems to be an expectation. And I think I want to talk about why a surgery intern year before we talk about how to do a surgery intern year. When it comes to doing a surgery intern year, it's good to do things because a program is an expectation. For example, my current program is everybody who is an integrated resident at UCLA, it's categorical, everybody does a surgery intern year. And so sometimes you get a sentiment when people say, oh, you have to do this, you're in a surgery intern year because it's required of you. But something that a mentality shift I had when I was on rotations was seeing the residents, particularly the second and third year residents that had come out of various intern years. For those that are MS1s, MS2s, you typically do a medicine year, a surgery year, or transitional year. Transitional year is a little closer to medical school where it's a little bit of surgery, a little bit of medicine, sometimes some pediatrics, and a lot more variability. And I would see the residents that came out of each of these, and nobody was incompetent, but the residents that came out of their surgery years had a different mindset, and they had a certain air of efficiency to them that I think you could just tell came from handling the patient load and the acuity that they did for that year, handling a heavy patient list. And you just see them, okay, this patient, is oozing from a drain site or their catheter or something like that. No problem. I'm going to go put a stitch in it, go back to what I was doing. They had a mindset of ownership when it came to their patients that I thought was really important. And so over the course of my VIR sub-Is, the thought process changed to, I'm only going to apply for surgery intern years. And that's something that when I talk to the attendings now as a surgery intern, they're like, because the sentiment still, it's a little outdated, but remains that, oh, you guys have to do this year. And I always tell them, yeah, but I only applied for a surgery intern year. One, because I saw the residents coming out of it, and two, because I wanted to engage in that mindset. I wanted to be immersed in this, thought process, and I wanted to get to know those departments. When it comes to picking your program, we can talk about that if people have questions when it comes to prelim versus categorical, things like that. But I think it's important, if possible, to do your intern year at the program you're eventually going to do all your training at. If it's a preliminary year, I think you have the ability to get to know other departments, how they think, what they prioritize, and there's a lot of opportunity there. So kind of some broad strokes here. It'll let me move. So we're talking about intern year directly from the SIR's website, kind of the three pathways that exist to this. Now it's really more of a two-pathway system, but we're talking about this first year here that is inherent to anybody who's applying for VIR or pursuing that pathway, that you're going to do 1 year of either surgery or medicine. When you're getting asked to be an intern, a lot of the generic stuff says, oh, this is the one that holds the pager. It's the one that makes the lists and pre-rounds, and it communicates between the team and others. And that transition comes pretty quick from being a medical student. All of a sudden, you're tasked with a lot of things that just a year ago, you were trying to go the extra mile and demonstrate this. And now it's the expectation. And with that expectation comes a lot of trust. The teams are trusting that you are the person that is talking to teams, that is following up on patients, that is making the connections between the patient, the team, and other services within the hospital. And so what that means is that you're going to be doing floor management, preoperative, postoperative evaluation, depending on the program, at least 8 hours, a ton of clinic time intern year. When it comes to what each rotation provides, some of them provide more clinic than others. But I've been very pleased with how much time we get in clinic in vascular surgery, a lot of surgical oncology clinic, things like that. And so when you're asking and trying to feel out your intern, you're asking how much clinic time, I think is always really important. And then there's education sessions. There's going to be different conferences that you go to on a weekly basis, grand rounds, things like that. So getting into tips for this, I know Griffin's also in this chat, so if he wants to jump in and mention anything, we're the same program. Number one, first and foremost, is to know your patients. When I mean know your patients, it's not just the procedure they had. It's not just, oh, they're post-op day 3 from a cholecystectomy. It means what medications are they on? How are they doing overnight? What were they like before they came into the hospital? Who are their family? How often do they want you to communicate with their family? You'll save yourself a lot of headache when it comes to, on a practical side, from pages, by knowing, hey, this is a patient who's very close with their family. Their family's calling all the time. So you can have the opportunity to kind of get ahead of that and communicate with family, which is always a good thing to do. Second thing is to get good at developing a system. There's a lot of templates and things that make it easy to kind of follow check boxes, and that's good. But if you gave me a blank piece of paper, I'd probably be able to jot down the same information that we do every morning in the same fashion. So that means you want to know who they are, the important things about their background, the same way you did when you're on your sub-Is, you're applying that as a surgery intern moving forward. Important things that happen overnight, their vitals, and this is going to lean into the third point a little bit. But as you're developing, you're looking through your patients, it's easy to check the boxes. But if you can anticipate, okay, this patient is on antibiotics. I know that they're on this one. Do they need to be on it? How long on it? And a lot of the patient's like safety and care runs through you anticipating this, because your seniors are in the OR. And so when they check back with you and say, hey, did this get done? You have your system to organize and prioritize along the way what you're going to get done in that day. Something that is important very early is trust but verify. I know that's like a cliche that gets thrown around, but it's when you get really busy, which, I mean, some honest truths about surgery intern year is that the hours are long, you're going to work hard, and people aren't going to be throwing a parade for you at the end of every day, but it's worth the amount of effort you put in. And I think the efficiency and the mindset that I saw in the second and third year residents as a medical student came from exactly that, demand throughout the year. So when you get busy, it's easy to reach out and say, oh, I want to make sure this person ate well. I want to make sure their urine output's good or they look okay. And just sending a message being like, hey, they look good, right? And the other side, somebody nods along or says, yeah, they're doing fine. If you get a page or something like that, it's just always better to go to the bedside. There was my second or third month rotation, there were some students in the room, and one of the fellows, just provided a good lesson. They say, hey, how did he look this morning? How does this patient look? Oh, I don't know. We're like, have you seen this patient? If this patient was sitting in the lobby, would you be able to identify them? And the student said, no. And the truth was, it was a new patient that night. I hadn't seen them either. And they said, okay, so you don't know what this patient looks like, but they're trusting you with their care for the entirety of their time here. So we need to rectify that. And so I've always taken that with me. It was like, if there's a new patient, go get to know them. And then if somebody says somebody looks good, trust your own eyes and at least go check yourself. Fourth point, never assume something's getting done. The difference between checking a box and being a true member of the team is, oh, I put in the order, versus I then followed up and make sure something got done. At the beginning of every day, once we finished our rounds, one of the best things to do is to call each team, not just put it in a note. Don't assume other teams know what's going on just because it's in a note, but you call the other teams and say, this is what we're doing. Here's the plan. Do you have any questions about it? Same thing if something's happening, and this is gonna, in the next point, this kind of builds on this, but if something's happening and you text your senior or you page your senior or something like that, don't assume that somebody is on the receiving end of that and it's been heard. You follow up. That's your job. That's the good skill set that you're building on as an intern, is that you follow up that something gets done. You follow up that somebody's heard you. You always communicate with another team, with members of your team, with the patient, with family members. And that's going to be what's going to make the difference between you being, just checking the boxes and technically getting through your intern year versus developing into a clinician. Second point on this page is the concept of load the boat. I was like this, that, intern year can be pretty intimidating. You're holding a pager. Some nights you're getting 80, 100 pages, and you're covering multiple services, and the list can get pretty long. And it feels like, how can I possibly handle all this? The idea that if you're concerned about something or you have a nagging feeling, to get as many people in the boat with you and say, okay, I've talked to the nurse, but I've also talked to the member on that team. I've talked to my senior, and if I need more help, you keep escalating, because ultimately you care about patients. Patients fight very hard, and it's your job to escalate to make sure that they get the care that they need. Another point is to stay humble. Medicine is humbling. Surgery intern year is very humbling. But as you get more efficient and as you get more skills, it can be dangerous to get a sense of like, oh, I've got this. You might be more efficient at something, but doing your due diligence to check something. And the same thing when somebody else asks a question, the way you communicate to other members of the team, other care partners within the hospital, it's somebody's asking a question because they don't know, or they have a concern, or for whatever reason, just remembering that, you can make a mistake. You're not perfect, and this process is there to teach you things. And so I think keeping an air of humility around you is very important to be a surgery intern and just a clinician in general. Next is be curious. This kind of comes from being, at least when I'm with the way that why I wanted to put this on here. You're going to be on a lot of different services, and asking the question behind the question. So if you're on thoracic surgery service and you're thinking, why am I spending so much time on cardiothoracic surgery? I guess VIR does chest tubes is the wrong mentality, but how do they manage their patients? How do they evaluate their patients with their conditions? If you're on, taking care of transplant patients, how do they evaluate when they are, on a priority list, or when they have a platelet count of 4, what they're going to do about that versus just giving them platelets. So asking why people are doing this, how they interpret other consulting teams, things like that. I think curiosity is huge as an intern. You're going to make mistakes. You try not to make the same mistake twice. Try to learn from your mistakes, learn from the mistakes of other people, try to save yourself some of the trouble, and have a system to not make that same mistake again. So you always try your best not to make a mistake, but it's going to happen, and how you handle that, I think, is more important than the fact that it happened. And this last one, it sounds so easy. Don't lie. You're going to be asked 1,000 questions every day from a team who's in the OR, who's trusting you to communicate with all these patients. And you say, hey, their Foley came out, right? It's very easy to just say, yep, but you don't actually, you put the order in, but you're not sure that it came out, things like that. Just being very comfortable saying, I don't know, but I'll find out. Same when other teams are asking, they're like, oh, they're not on any blood thinners, right? No, they're not. Or I'll go check and I'll let you know, right? If you didn't do something or something like that, there's a ton of workflow. Your goal is to keep working to the point that you get the work done and you're efficient about it. But that doesn't mean that you just, you have to remain honest along the process. Whatever this one is. Okay. Some final ones here. So it's because of the hours and the work that come with a surgery intern year. Sometimes it can be easy to just try to get through the day, but there's so much opportunity in each rotation. For example, in vascular surgery, we get 2 months of vascular surgery this year. People are debriding wounds in clinic. They are evaluating different dressing changes and how to do more advanced wound care. If you want to get involved in that, asking for it and seeking out those opportunities is huge. If you want to get involved in the cases they're doing, their post-op care, their multidisciplinary conferences, those opportunities are there, but the expectation is, oh, these interns are working really hard, so we're not going to ask them to come sometimes. And I think being a little more intentional and proactive in seeking that out can be the difference between getting what you want out of your intern year in addition to what's expected of you. In addition to that is medical students. It feels kind of weird because you're just a medical student, sometimes 6 weeks before, and now you are responsible for medical students. Interns lead the group of medical students in how they're functioning. So on rounds, when you're anticipating, you're making that list in the morning, you're teaching them how to do those same skills. And then if the team's running slowly, the answer is not, oh, the medical student didn't know the answer, wasn't prepared. It's no, the intern didn't prepare the medical student well enough for that opportunity. So a lot of that's delegation and making sure that, okay, we're going to go in these rooms. You have your wound care buckets. You have, you know about these patients. What questions do you have? What are you going to be doing for this patient? And what is our plan for them? Something that a mentor told me that I find very helpful is there's times where you're waiting around, say a senior has to run to go see a consult and you go with them to the consult, or sometimes we're waiting on the attending and you have 1 minute, 3 minutes, 5 minutes, working on some presentations that you can go over with, okay, I have a 60-minute or 60-second talk on DVTs, or a 3-minute talk on portal hypertension, and just little educational bite-sized conversations you can have with students while you're waiting for the next thing to happen if you have that downtime, rather than just, sitting around. Getting comfortable with feedback, constructive feedback when it comes to medical students, is something that you're going to be asked to do as an intern. You get a lot of responsibility in that role, and I think it can be uncomfortable to tell somebody opportunities for improvement, but it's a very important skill to learn. Okay, you're pretty good at this, but you're a second-year medical student. We're going to work to get you, to maybe the level of a third-year medical student, or here's some things that could help you get to that next level. What questions do you have? And then opportunities to get the medical students involved. You want to get in the OR, you'll get in the OR as a surgery intern, but so do the medical students, and finding ways for them to do something as small as like, hey, you want to go take this chest tube out together, versus, let's scrub into this. And if you're on one side, you're going to get to do more of the case if you're working with this attending. Finding ways to advocate for your medical students, get them involved, and then get them to, have ownership over the patient, because that's ultimately what they're working on and building. Everything that comes with being a surgery intern comes with the expectation that you are going to work hard. A lot of the benefits that come from a surgery intern year are based in the amount of effort that goes into it. You're in there first, you're usually out there last. You're in there because you're checking on the patients for the team so that things run efficiently. I try to move away from the idea of scut work, and really it's, okay, the more that I'm doing of this, the better that I'm now when I'm a level above this, understanding the bite-sized pieces that need to get done. So that's, you're going to work hard. You want to be the first one in, the last one out. You're also an ambassador for your specialty to all these different surgery departments. I love hearing that they say, you would have been a really good vascular surgeon, or, why did you choose your field? And you get to take the opportunity of, like, I can fit in this department. I have the surgical mentality, and here's why VIR is the coolest thing ever. And then when you're making connections with these fellow interns that are head and neck and surgery and all of this, they're going to be consulting you, you're going to be consulting them. There's a mutual respect that comes from, okay, the VIR department here works really hard. Those are some really good residents, and I respect them. So, and that comes from that first in, last out, work hard mentality. Alongside that, as you're working hard, you need to figure out what makes you you. For me, that's spending time with the people that I care about outside the hospital when possible, getting exercise, trying to get enough rest. Those things, if you just passively go through, you have time for almost nothing, but you can make time for anything. And so that's been very important to me. And I think that's been the difference between getting through surgery intern year and really being able to thrive within it. So, Griffin and I are about 2/3 of the way through. We were in medical student shoes very recently. I think we could answer any questions along the way. Here's my contact information. Feel free to reach out anytime. I will get back to you when I'm not, in the middle of maybe rounds or something like that. But I think WCVIS is such an awesome process. This is the coolest specialty and the coolest field in the world. And just happy to help out where I can.